approach our lifestyle. All of those are critical elements that give us a unique opportunity now to formulate those into very powerful opportunities for ourselves. Now, if we look at the things of being unhealthy, or we look at some of the processes that exist, we can categorize them very easily into 4 distinct categories. One is immunity. Now, we know that there's a lot of stressors that are associated with our immunity. Stress, toxicity, poor diet. We're always either moving closer to or further away from our body's own capability to be well. We're never stagnant in our health. We're never stagnant in the movement that we have to create for ourselves. We also have diseases or challenges of deficiency. This is focused specifically on nutrition, and that's constantly, why do we have nutritional products in doTERRA? This is primarily the reason why. Your body is driven by nutrition. And then we have circumstances of heredity. This gets to be a little bit more challenging for people, and you've probably had experiences, or maybe somebody in your family has had an experience where your doctor might say to you, tell me your family history. Has anybody in your family had cancer? Well, you're at a higher risk. Has anybody in your family had heart disease? Well, you're likely to have heart disease too. And we really have talked a lot about in doTERRA about genetics, the human genome, and how we can influence that. And just because you have predisposition for something doesn't mean that it has to manifest. There's wonderful research that has talked about this for a long period of time. For example, a protein called apolipoprotein E is a good example in its association with heart disease. And if you have that particular protein, chances are you're going to get heart disease unless you exercise, don't smoke, don't drink, and eat a healthy diet. And then your chances are almost zero. And so issues of even heredity, even though I cannot change your genes, I can't change your genetics, but we can influence and change how your body reacts to those. And then finally, we have conditions that are physiological. This is things or circumstances that affect your body's ability to perform in all of its physiological processes. We might say, for example, something like Alzheimer's fits into this particular category. What they all share in common is the exact same thing, and that is that they are preventable through lifestyle. I think about where we are in healthcare right now and all the wonderful advances they are in medicine. I have a good friend of mine who has gone blind. I got a note this morning talking about his surgery went well and they anticipate that he will now see again over the next couple of weeks. What a remarkable thing that actually is. But when it comes to these prescriptive circumstances where our health diminishes, or where we're in our lifestyle and our lifestyle predisposes us for things, these are things that lie within our control. This is why we talk about it so incessantly within doTERRA, to provide for ourselves this opportunity. And how we do that is through the wellness chart. Now, I promised them yesterday, even though they changed that word to chart, I promised them I would call it what it really is, the wellness pyramid. The wellness pyramid was designed, sorry, it's just my little way of sticking it to the man. The wellness pyramid, and the man, by the way, is all the legal people who happen to be here, just so you know. When we talk about the wellness pyramid, this is your daily model of health. We can look at each one of these categories. We can talk about the foundational aspects of nutrition and digestion, and you can think about products that lie within those categories. Today you're going to learn about some new ones, but we also have a history of vitamins and minerals, probiotics. We also know essential oils like DigestZen or Zengest, and ginger and peppermint, and many that support those processes. And we can go through each one of those categories, and each one of them is your guideline for what you do on a regular basis to help your body become more resilient, being more proactive in your own health. Now let me lay for you a new concept of something that has been present in my mind for a long period of time. and is centralized around how our body is designed. Now, thinking all the way back to high school and the things that you learned when you were very young, you know that your body is made up primarily of cells. More than 30 billion cells exist within your body. And we have, within those cells combine to form tissues, and tissues combine to form organs, and organs combine to form body systems, and body systems makes up the whole of who we are. And so in a very real sense, when we talk about your health, we're talking about the function of your individual cells. Now there's some uniqueness with this because all conditions of your health is intrinsic to your cells and whether or not they're functioning like they should. And there's a lot of things that challenge us in this domain. And that is, for example, the amount of toxicity, a lot of environmental factors, the amount of stress that we experience and that we have and that we're exposed to with consistency. How many of you feel like you're stressed? If you're not raising your hand, you're not being truthful, just like you were earlier. And we're going to come around and squirt oregano in your eye, because we all have stress. And these are the things that over time degrade our circumstance in ways that are unfavorable for us. Now that means, if it really is about our cells, that means it's about cell signaling, how our cells effectively communicate with one another. And there's two types of signaling pathways, or two types of cellular pathways that we're concerned about. One is signaling pathways. These are pathways that work in and out of the cell. And then also we have nutritional pathways or metabolic pathways. Now, signaling pathways are important for a few different reasons. I've always said something very clearly about the essential oils. A number of years ago, I remember it vividly, I was giving a presentation, and in the middle of that presentation, I felt like I had an epiphany about how and why essential oils were actually working, why they were creating the benefit for us that they were, because previously I only had thought about all of the chemistry of the essential oils. And in that moment, I said something very simple. I said, I believe that essential oils are effective for these reasons. One is that they're biologically active. This is known chemistry to the body. This is organic chemistry. It's recognized by the body. It's able to be utilized by the body with great efficacy. Secondly, we know that the oils are active and that they have specific cell targets. At the time, we had begun doing some study and looking how the essential oils interacted with cells, and we knew that they were interacting with specific cell targets on the surface of the cell, receptors. We also had discovered that we knew there were targets directly within the cell. Thirdly, the other thing that I said was, we know that essential oils are selective. At the time, I did not have the equation in my mind as to how and why it was, but I knew that there were differentiators with the essential oils. For example, how is it that frankincense, on the one hand, can be protective of cells, protect them from degrading, work within the DNA of the cell for transcription errors and other things, which now the research is replete with essential oils doing that, not just frankincense, but many essential oils. And yet at the same time, in the case of a cell that's been degraded for a variety of different reasons, that's not able to be prepared or rejuvenated, the body can go through apoptosis, can destroy, can eliminate that cell. It's problematic. It might mutate. It might create other challenges. And it works within the environment of the body. And although I didn't have a lot of definition at the time, cell signaling is part of the way that that's happening. In the future, you're going to hear us talk more and more about how the essential oils then act as chemical messengers directly to the cell. In my dialogue about how essential oils are biologically active, how they have specific cell targets, how they're able to differentiate, now makes perfect sense, even to me. This was an epiphany now where I connected all of these dots, as simple as it sounds, just about 8 months ago. It's amazing to me that in all the things that we now know about essential oils, all the study that we've done, all the research that happens consistently around the world with scientists and hospitals and all with their own directives, and many of them shared in the same